Vaccines are not readily available in many countries. Yet when a limited supply does arrive, people are not always interested. On March 25, South Sudan received 132,000 doses of the AstraZeneca COVID-19 vaccine through the COVAX program, the global effort to provide vaccines to poorer countries. They were free to all comers. But there was no rush to get the vaccines. As of August 3, only 56,989 vaccine doses have been administered in country of approximately 12 million people. South Sudan returned some 72,000 doses to COVAX, which were shipped to Kenya instead. South Sudanese physician Edward Kenyi, now living in the US, plans to send this letter to his mother, Elizabeth, who's opposed reluctant to take the vaccine, to try and change her mind. The last time I called you on the phone a few weeks ago, you told me you were yet to take the COVID-19 vaccine. Although I have been telling you to take it for weeks, you said you are still waiting for the right time. I hope this letter will persuade you once and for all that the time is right now. Mum, since the beginning of the pandemic, when cases were rising in South Sudan and many people were dying of COVID-19, I implored you to take the necessary precautions to avoid catching the disease. You're in your 70s, which puts you among the most vulnerable groups of people at risk of getting seriously ill, and of dying. Before the vaccines were invented, you told me you heard messages broadcast over the radio every day and saw many big posters on the streets advising all to wash their hands often, use face masks and practice physical distancing to stay healthy. Every time I spoke to you, you were either going to a funeral for a relative or returning from the marriage ceremony of another. You said even at these funerals and marriages, they talked about precautions. You told me that at some of the funerals you attended, no one would declare the cause of death, but that many people suspected COVID-19. In those early months of the pandemic, you seemed to take the disease seriously. You were concerned about me in America, where the disease was affecting many people, and advised me to be very careful. However, with time you have stopped taking the disease seriously. You told me you heard the disease is no longer a threat in Juba, where you live, because the number of people testing positive or dying from it has declined. I know that this is not true. Here's what the numbers say. As of the end of July 2021, there have been 11,090 confirmed cases of COVID-19 with 120 deaths, reported to the World Health Organization. And when I've urged you to avoid going to funerals for the time being to avoid exposure to the virus, or to at least wear your face mask, you told me that people you know say black people are immune in general, and if they're not, they do not get serious disease.